Guys, in this video, let us look at this forensic topic that is called precipitate labor, okay, or precipitate delivery. It is sudden delivery, okay. Basically, here what happens, all the stages of labor, they get merged into a single, precipitate labor or delivery is merging of all stages of labor into one, thus labor. So basically, all stages get merged into one. So there's going to be sudden delivery, okay, sudden, right? So all stages merged into one. This labor terminates very short time. In very short time it will terminate, right? It occurs so suddenly and rapidly that the mother has no knowledge of it also. Okay, so this is actually something that is possible naturally in the world, but as forensic we should know it, okay? Basically, where you will see it, if there is grand multipara. Grand multipara means they have given birth many times, right? That can happen that, the grand multipara, you have given birth so many times that it is, the baby just comes out suddenly, right? So it can happen during fits or period of coma. It can happen in hysteria, hypnosis, intoxication, anesthesia, it can happen. So basically you do one thing, you just remember the common things, okay? Common things are what? Multipara. A lot of kids these people have. They have now one more which is just coming out very, very easily in short time. Periods of coma and fits, hysteria, hypnosis, intoxication with narcotics, alcohol, anesthesia. This is very common, okay, in these conditions. Now, what is not common? What is not common you see now, listen to this. If it is a primary para, that is first time pregnant, it is very, very rare, and in sleep also it is very rare. So this person will have to be intoxicated or will have to have hypnosis, hysteria, fits, something, right, which can lead to this. So this is very much possible in grand multipara. That is, they are having a lot of children. So if a woman has given birth 5 or more times, right, then it's grand multipara. So just make a note of that word, okay? Grand multipara, greater than 5 times they have given birth. So what happens to this, what is the result of this birth? Okay, you have seen the causes. Now result, we will see what happens to the fetus. The child which is born may be normal, it may be premature, but it can also die. The child may die because of, it may die after being born alive. It can die because it can either die of suffocation, it can fall into a lavatory, like when she went to pass stools or something, falling into the lavatory or in the toilet bowl, into a bucket, so there can be death. It can fall on a hard surface, the fetus can fall on a hard surface and it can die. Hemorrhage can be there because the umbilical cord can be torn, right? So because of hemorrhage from the torn end of the umbilical cord, the fetus can die. Then findings, guys, so you're understanding there can be death in this case, okay? So basically there can be suffocation, air passages will show liquid, blood, right, meconium, it can be there, vaginal mucosa can be there in the air passage, microscopy will show foreign particles, okay? Accidental fall on hard surface, what will you see? Subdural hemorrhage, which is bilateral, scalp may be injured, hair may show foreign materials like sand, mud, etc. Fracture of the skull, usually there can be fracture of skull, right? Usually fissured or limited to parietal bones. So you can understand. So you should understand why this baby, what will the findings be, okay? Normally an umbilical cord, right, it is about 50 centimeter long, let's say, okay, 50 centimeter long. It is enough to sustain the weight of a fetus without breaking. But if the umbilical cord breaks, if it tears, right, from the torn end, okay, there can be hemorrhage which can result in the death of the fetus. Here they are saying when the umbilicus usually tears like that, the torn end is near the fetal end it will tear, okay, that's what they are saying here. Now, what is the medico-legal importance, guys? Let us look at the medico-legal importance in this. Basically, here what happens is, it could be that the mother did not try to kill the baby, right? The mother may be charged with infanticide, though it is a precipitate labor, right? An infanticide, somebody can do an infanticide and come and say no, that it is a precipitate labor. So, you'll have to distinguish by these findings, what will you find in the airway, what fractures, umbilical cord, you have to decide by all that, okay? So basically you have to decide with what? The airway, the fractures, etc. and the umbilical cord, etc. Okay. So here they have mentioned subdural hemorrhage can be there, right? Often bilateral is the word they have used here. Okay. So that is all for now in this video. We have finished this topic, precipitate labor. Okay. Bye bye.